Moving on swiftly. Can Kenya's healthcare system bounce back? The transition that we are talking about when we are asking and talking about these issues is that Kenya has a progressive constitution, ambitious healthcare reforms, and dedicated healthcare professionals. Yet significant challenges remain in financing, implementation, and equitable access. The next question, therefore, is whether Kenya's biggest healthcare promise, universal health coverage, can bridge the gap between policy commitments and the everyday experience of the patient. The next question, and I will repeat, therefore, is whether Kenya's biggest healthcare promise, universal health coverage, can bridge the gap between policy commitments and the everyday experience of patients. That is where we turn next. Meaning, therefore, universal health coverage. The promise of the Constitution is that every Kenyan, regardless of their age, creed, economic status, tribe, or color, or race, religion, is supposed to receive universal health care coverage. That they are supposed to access healthcare, quality healthcare services. Is that happening in our country? We hear about our president touting, waxing lyrical every day, each and every day here and there, that we've achieved universal health coverage, the last mile for healthcare, that everybody in this country should go to hospital and not be asked for anything for outpatient services and things like that. But is that the real question on the ground? Has Kenya achieved universal health coverage? Is anybody who's sick in this country being able to get good treatment, quality treatment, and good care from healthcare professionals? That is the question that we need to answer. That in determining healthcare issues, the healthcare sector, to be able to confront it and to be able to manage it, we need to ask these difficult questions. As politicians talk about universal health coverage, is that the situation on the ground? The central objective of Kenya's health reform is universal health coverage. That is what we are going to talk about next. Commonly known as UHC. The World Health Organization defines UHC as ensuring that all people receive the health services they need. That is the question. That is the definition. I will repeat. The World Health Organization defines UHC as ensuring that all people receive the health services they need. These services should be of sufficient quality without suffering financial hardship. In simple terms, no Kenyan should have to choose between seeking medical treatment and feeding their families. Basically, that is the picture that is as answered today's program on the bounce back of Kenya through the lens of healthcare coverage. How many Kenyans today, and we've talked about that previously, how many Kenyans today are not in groups, they are not in fundraising committees, they are not fundraising for patients, they are not doing harambes to make sure that their loved ones are getting quality healthcare? That is the question that UHC is supposed to answer. That if today you're in a WhatsApp group, you are in a group that is fundraising, that you're doing a harambe today for someone who's sick, that you're doing an appeal today for someone who's sick, that you're scared of being sick because you know once you get sick, you are a minute away from poverty, then Kenya does not have a bounce back with regard to healthcare issues. We are not there yet with regard to healthcare issues. That if you and I are contributing for some sick person somewhere, are contributing for a loved one, that we are scared that our resources will go away, will be diminished because we cannot be able to afford healthcare in this country, then we have not achieved UHC in this country. Then we are lying ourselves. Our politicians are lying to us that we have achieved UHC if indeed we cannot be able to get access to quality healthcare. It is a shame in 2026 that we have people in this country, people of means, people in government, people with sufficient insurance going to other countries to seek for better quality medical care. That is so unfair, because the promise of UHC is a reserve of the leadership, is a reserve of government policy, is a reserve of county government policy, is a reserve of our leaders, the governors, the CECs, and the people who are running healthcare in the counties. But they go seek for medical care in other countries abroad. So that you and I, the poor, the tax laden, those who do not have money, those who do not have access, continue languishing in the poverty in this country that has been wrought by the lack of quality medical care. And that is why we should support all our doctors whenever they clamor for better rights, because they are fighting for you and I, because it is us who are left in the cages in our country, Kenya, with insufficient hospital equipment, with no drugs, with not enough healthcare professionals, while others go abroad to look for other healthcare facilities in countries that have invested in healthcare and leave us here. They talk about policy, they leave policies in wonderful, good, well manicured and bind documents, and they present this and that and put that in a pedestal, but they leave you and I to suffer as they go seek for quality healthcare in Switzerland, in Belgium, France, and these big countries, the United States. That is wrong. We do not have UHC, and we need to talk about it. We do not have a bounce back if that is the issue. We do not have a bounce back of Kenya if healthcare is not UHC. Because you cannot call healthcare UHC if I have to sell the land that has bequeathed my children, that I am going to leave as an inheritance to them. I cannot sell it so that I can be able to buy drugs. That is not healthcare. That is not a system that is supporting the populace. That is not the inalienable right that we are talking about. Let us go on. So universal health coverage is also embedded in Sustainable Development Goal number 3, which seeks to ensure